Many thanks for joining us. The Kenya National Union of Nurses has called for a nationwide strike of nurses starting Monday. This even as the Salaries and Remuneration Commission maintained today that there is no funding for the allowances the nurses are demanding. And as Dorcas Wangira reports, the Senate Labour and Social Welfare Committee meeting scheduled for today to deliberate on the strike aborted due to lack of quorum.
I'm advising and calling upon the nurses of Kenya to come out and strike as we have never done in this country, so that we can show Kenyans that we are also important in the healthcare sector.
Such strong sentiments issued by Maurice Opetu, the Deputy Secretary General of the Nurses Union, forecast what next week will look like if nurses who have not yet taken part in the strike heed the call. This morning, Friday, the Senate Labour and Social Welfare Committee had scheduled a meeting to continue with the conciliation process that will see the nurses return to work. The meeting aborted due to a lack of quorum. However, the back and forth continued with no single position from all the stakeholders.
They are cooperating with the conciliation committee and they are making very good progress.
The SRC's mandate to set and regularly review the remuneration and benefits of all state officers and advise both levels of government on remuneration of all public officers is at the centre of the matter. The union saying the SRC is not the controller of budgets and should not issue negative advisories, further accusing the Council of Governors, the COG Secretariat and the SRC of frustrating the nurses.
Why did they bring complications when it was about governors' mansions? When it is about entertainment allowances, unapata budget kwa ofisi ya governor ya mandazi na chai.
The SRC, who had representation at the meeting, later in a press conference maintained their position.
The counties that have written to say they have a budget is less than 10. And even that number, we have asked them to confirm whether they have funding. Because as I said earlier on, budget is a budget. But do you actually have the funds to pay?
But I've spoken to at least 7 counties. Wanasema wanataka kulipa, lakini wanaambiwa kuna objection inatolewa na idara mbalimbali. Lakini wao wanataka kulipa, wamekubaliana. Kuna counties ambazo wameamua wanalipa, lakini wanalipia watumie hiyo system ile ya kawaida ya kompyuta, wanafanya voucher na zinapelekwa kwa accounts za nurses. Nursing allowance, yeah, 20,000 shillings, around 25,000. Each county unaweza pata mwaka mmoja it coming to 28 million shillings.
Other than the lack of fiscal sustainability, the SRC has argued that ceding to the nurses' demands will offset more demands from other cadres in the health sector, such as clinical officers, who have already issued a strike notice, and will violate the principle of equity and fairness in the public service.
Where is the equity? Where was SRC when other cadres were given huge amounts of allowances that we never demanded?
Thus far, according to the union, this is the status of the ongoing strike. There are only 4 counties that have honoured the agreement of November 2017 and paid the 2 allowances: Nairobi, Kwale, Migori and Machakos. 13 counties have not yet reached a deadlock which will warrant a strike notice. These are Baringo, Laikipia, Meru, Bungoma, Nyamira, Isiolo, Kajiado, Kericho, Lamu, Kilifi, Turkana, Uasin Gishu and Nandi. The counties where the strike has been suspended after the counties engaged the nurses union are Mandera, Vihiga, Tharaka Nithi, Nyandarua, Kitui, Kiambu and Garissa. With Mombasa, the count of counties joining the strike rises to 23. And with SRC's position, Monday will be a defining day for nurses' action. The conciliation meeting was adjourned and scheduled for a later date that will be communicated by the committee chaired by Nairobi Senator Johnson Sakaja, and whose decision millions of Kenyans' lives depend on. Dorcas Wangira, Citizen TV, Nairobi.